If you've turned on the TV in the past few weeks, you couldn't miss one of two sets of images. The first is our new president attempting to weave his way through a long list of complex issues to steer the country down a different financial path. The second was Nadya Suleman, a young divorced parent of 6 who just gave birth to 8 more children with the aid of a reproductive specialist. What do these two stories have in common? Well, in both cases, the roles and responsibilities of individuals, communities, and society are up for grabs. Putting it bluntly, who should be allowed to do what and when? The focus of the government for now is clearly on the financial sector and the new rules and regulations to deter the types of behavior that got us into this mess. I'll let the experts deal with that. As for our young mother of 14, I have to agree with medical ethicist Arthur Caplan. The idea of a physician being allowed to implant 8 embryos in a young woman with 6 children is ethically bonkers. Now, Dr. Jamie Griffo, director of the NYU Fertility Clinic, in a joint appearance with Caplan on the Today Show, reaffirmed the voluntary standards of a maximum of 2 embryos implanted at any one time in women under 35. That's the rule of the American Society of Reproductive Medicine, or at least their recommendation. And it seems to suggest that there wasn't much more that could have been done to control an occasional crazy case. This aversion to placing into law protective rules that would assure some logical limits to human misbehavior, I find bizarre. If something is clear enough and defensible enough to be the basis for a national organization's endorsement as a voluntary guideline, why not have the guts to do it right? If the American Society of Reproductive Medicine had been as focused on supporting legislation to assure sane limits as they likely were in preventing unwanted government intrusion into the private practice of medicine, would we be wondering this week what will be the destiny of these 8 new lives, let alone the other 6 and their mother who, with the support of her doctor, played out her dream unencumbered and free? This isn't the first time that the issue of regulation and the practice of U.S. reproductive specialists has been front and center. I've covered it myself several times in the past 2 years. Twins from IVF are more common in the U.S. than they are in many other nations because laws in other countries prohibit implanting more than 1 embryo at a time, let alone 8, as was the case here. Twins do have higher rates of preterm birth and low birth rate. Mothers giving birth to twins require more bed rest and are more vulnerable to premature labor, hypertension, birth hemorrhage, and cesarean section. Triplets and beyond are uncommon and markedly adjust risk upward for both mother and child. To their credit, most U.S. infertility programs fully inform parents of these issues prior to deciding to proceed with IVF. And parents are often more than happy to make whatever sacrifices necessary. According to Nadya Suleman, her reproductive specialist fully informed her too. Technically, everyone followed the rules. But that doesn't mean that either doctor or patient here were playing with a full deck. The time has come for professional organizations of all types to encode legally broad terms of responsible behavior. Voluntary guidelines in this instance and in so many others provide little protection except to those in charge who lack the wisdom to do what is right. For Health Commentary, I'm Magee.